We are following the battle against COVID-19 here in Oregon, and the state is seeing a spike in cases. Today, we saw the highest numbers yet. The Oregon Health Authority reporting 805 new cases today, and 5 more people have died. Governor Kate Brown plans to speak about this tomorrow, about the surge we're seeing. And this comes as the U.S. also hit a bleak benchmark with 100,000 cases reported in a single day. That was yesterday. And health experts are now addressing a recent uptick in hospitalizations in the Portland area and across the state.
Numbers from the Oregon Health Authority show a rise in cases in mid-October. Fox 12's Sarah HURWITZ spoke with healthcare systems about the possibility of a surge as we get into the colder months.
Hospital directors told me today that right now they are able to handle the number of COVID-19 patients, but that could all change as we get into some of the colder months, fall and winter, when it's more difficult to practice some of those safety measures that healthcare officials say are easier to do in the spring and summer. COVID-19 cases in Oregon are on the rise.
It is going to be a challenge moving into the fall and into the winter, and there's really no way to sugarcoat it.
David ZONIES, the Associate Chief Medical Officer for OHSU, says that our region's healthcare systems are now seeing higher rates of COVID-19 hospitalizations. Right now, he says they are able to handle those numbers, but that could change. ZONIES says that healthcare systems are working together to come up with plans to reallocate patients to other hospitals in case some in our area are maxed out.
Once we reach a critical threshold, then we start to reallocate and start moving patients around to find beds that are available and providers who can care for them. We are trying to level load and balance the care for these patients, really thinking just beyond OHSU in particular, to looking at all of our hospitals as really one regional hospital.
John McCreary, Legacy Health's Vice President of Medical Affairs, says a possible surge in the next few months all depends on the positivity rate in Oregon.
If we take an optimistic view of that and it stays with a lower transmission rate, then we'd see something similar to right now. But if it continues on the trajectory that's been over the last couple of weeks, we would expect to see more COVID patients than we do, and put more of a burden on the health systems.
McCreary says while there's an uptick in COVID hospitalizations, he says fewer patients are needing to go to the ICU, and their length of stay overall is shorter. And Providence also told us today that at this point it's not experiencing a surge, but it did say that there's no way to predict how people are going to behave in the next couple of months in terms of social distancing, washing your hands, and wearing a face mask. And all of the healthcare systems that we spoke with said that they are prepared for a possible surge. From the mobile newsroom, Sarah HURWITZ, Fox 12 Oregon.